Imagine this. Tens of thousands of people in one of America's most vulnerable states could soon lose access to affordable health care. It's not a dystopian movie plot. It's the reality facing West Virginia as pandemic-era tax credits are set to expire at the end of the year. The stakes couldn't be higher, and the clock is ticking. 15 years ago, the Affordable Care Act, ACA, revolutionized how Americans accessed health insurance. For the first time, millions found themselves able to secure coverage that had previously been out of reach. Fast forward to today, and nearly 70,000 residents in West Virginia still rely on these supports to afford their health care plans. But here's where it gets concerning. Without action from lawmakers, those critical financial lifelines may disappear, leaving countless individuals and families scrambling to make ends meet. Del. Mike Pushkin, representing Kanawha County in West Virginia's House of Delegates, has sounded the alarm about what this means for his constituents. By failing to extend these tax credits in the president's bill, he explained, they're putting almost 70,000 people in West Virginia at risk of losing their health care entirely. That's no small number, especially in a state already grappling with some of the nation's toughest economic challenges. And this is the part most people miss. West Virginia currently holds the unfortunate distinction of having the highest marketplace premiums in the country. Without subsidies keeping costs manageable, experts warn that premiums could skyrocket even further. Rhonda Ragombi, a health and safety net policy analyst, predicts an average increase of 133%, or roughly $1,400 per person annually. She estimates that around 15,000 West Virginians might drop their coverage altogether simply because they can no longer afford it. For perspective, imagine choosing between paying your rent or keeping your family insured. That's the kind of impossible decision many could face. Pushkin isn't holding back when it comes to criticizing state leadership either. He openly questions whether Governor Jim Justice and the Republican-controlled legislature have any intention of stepping up to protect West Virginians. I don't see much willingness from the Republican supermajority or Governor Morrisey to do anything meaningful about this issue, Pushkin lamented. This will create real hardship for states like ours. His words paint a bleak picture of political gridlock colliding with human need. But there's a glimmer of hope. Ragombe mentioned hearing encouraging whispers from Capitol Hill, including reports that Senator Shelley Moore Capito is among those pushing for solutions. Lawmakers are reportedly considering ways to extend the expiring tax credits before open enrollment begins on November 1st. While this news offers a ray of optimism, Ragombe remains cautious, reminding us that nothing is guaranteed until legislation is passed. What happens next is anyone's guess. If history teaches us anything, however, it's that uncertainty often leads to unintended consequences. Ragombe worries that if affordable healthcare becomes inaccessible, people may start prioritizing other necessities over their own well-being. When we limit access to care that's both affordable and accessible, many will choose to drop coverage so they can focus on survival basics, like shelter, food, and feeding their kids, she said. This raises a troubling question. Should anyone ever have to sacrifice their health just to keep a roof over their head? Now, here's where things get controversial. Some argue that extending these tax credits places too much burden on taxpayers, while others insist it's a moral imperative to ensure everyone has access to health care. Where do you stand? Do you think Congress should step in to prevent a potential crisis, or should states take responsibility for finding local solutions? Share your thoughts in the comments below. We'd love to hear your take.